Hello, hello, everyone. We are getting ready for our weekly Saturday broadcast on KDOW, the number one healthcare radio show in the Bay Area and the number one women in innovation podcast in the nation. So stay tuned. Those of you on YouTube and other social media, get the behind the scenes of our live radio broadcast. So you get to hear everything that happens
Sponsored
during the
by
commercial
Weight of My Heart
breaks.
Incorporated.
Welcome to the Heart of Innovation, 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhelp.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kym McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hey everyone, welcome to the show. It's American Heart Month, and your leg health can indicate your risk for heart attack, stroke, and amputation, a disease called peripheral artery disease, poor circulation in the legs. And 70% of Americans still don't know about it until it reaches advanced stages. If at all, they might have a heart attack before they even understand why they struggled with walking. We have quite a few people with PAD here today to share their story, Dr. Phillips, in what I'm calling a Save My Piggies episode on steroids. We have Francine, we have Carrie, we have Pamela, we have Teresa, we may have Jamie, and also maybe Marina. We might even have Douglas. So this is going to be an epic hour on lots and lots of sharing and learning.
Indeed, it sounds like we don't have a lot of time to chew the fat here, and we should probably just jump right into this. We've got a lot of folks that have stories to tell, and really that's what Save My Piggies is about: letting patients and their physicians kind of share the trials and tribulations of the disease process. And unfortunately, just real quick, I mean, a lot of times people don't know that they have PAD because a lot of them don't have symptoms, but that doesn't necessarily mean that they don't have risk factors or suffer from a disease that, in some degrees, as we've discussed, has a higher mortality rate at the 5-year mark than a lot of cancers. So very important topic to try to unpack today.
Yeah, and especially I have to say I'm a little low on my emotional bandwidth today, because last night I had the fight of my life with a patient. And this is why we drive home the importance of early diagnosis and choosing the right doctor, different doctors, different tools, different techniques. Just because they treat PAD does not mean they're an advanced stage or advanced skilled critical limb ischemia operator. And last night with a patient after a revascularization, a little roto-rooting, she ended up with, maybe you can describe it for people, it's compartment syndrome. And the doctor, she was screaming for hours. They kept upping from Norco to morphine and saying it's just reperfusion injury, reperfusion pain. And I kept saying to the mom, you got to tell him, you got to ask about compartment syndrome. And the doctor finally came in and he felt the toes and felt her pulses. You have pulses, your feet are warm, you're fine. And I said, ask him to check the legs, ask him about compartment syndrome. And that was the only time that he actually went around and felt the legs. And he said, oh my God, I think you do have compartment syndrome. Let's get her to the OR. And I said, you ask now about a fasciotomy or amputation. And it forced him to stop for a second. He's like, well, yeah, okay, we'll do the fasciotomy first. She has her leg this morning. That's all I can say. But it was the fight for that leg last night like there's no tomorrow. 3 hours listening to someone scream in agony with no support. It just blew my mind. It doesn't have to be that way at all.
Did she have the fasciotomy?
She did have the fasciotomy.
I've had one. Very painful.
Oh, you did too?
I did.
Yeah, Pamela, do you want to start us off then with your story? Tell us about your experience.
With the fasciotomy, I had the wound had got infected from where they had removed a blood clot, and a piece that they had put on it in surgery had a superbug Mercer staph on it. So my leg got infected, and I went through 22 weeks of hospital and rehab trying to save my leg then. So
Wow.
They're no fun. I've had skin grafts, everything that goes along with that. I had a permanent foot drop because of the fasciotomy, damaged the peripheral nerve. Um, yeah,
How long did it take them before, you were probably screaming in agony as well from pain?
Yeah.
Oh yeah,
So
right. It's wretched.
it
And
come on, it would hit it. It was like it was pounding in my leg.
how long between, you actually are, saying, "Hey, I'm in pain," and them actually acting on the compartment syndrome to do the fasciotomy to release the pressure, right, Dr. Phillips? They have to release the pressure by cutting down the leg.
Took a
Yeah.
lot going to my lungs before they took action.
Now, see, that's a little interesting because um, a clot going to the lungs presumes that you had a clot in the vein, which typically when we're doing fasciotomies, we're doing that in the setting of a blocked artery.
Right.
And so your situation must be a little bit unique there, Pamela. But to answer your question, Kym, yeah, I mean, there's certain compartments within the leg, thigh, or, knee above and below the knee, and it's a fixed space. So when you have issues with reperfusion or lack of blood flow and swelling, it can only swell to a certain point, and then, among other things, you start to necrose or lose the muscle, and uh, the leg starts to die basically, and you kind of have to release the pressure. A very emergent procedure for the most part. Sounds like that's what happened last night with that
And
patient.
supposedly it's pretty rare, and it doesn't mean like in Pamela's case that, there's no serious wrongdoing on the part of the doctor. There are a lot of reasons why this can occur. It could be, for example, in this case from last night, she had gone so long, Dr. Phillips, without any blood flow. The turning on the faucet shocked the heck out of her leg, is what the doctor said. And I believe him. I've seen it happen before.
Yeah, no, I mean, again, it's when someone has significant lack of blood flow to an extremity, and the extremity remains viable, meaning you can save it, then you do what you can. And when you restore blood flow, it just basically, in our layman's term, it releases bad humors that then can cause changes in permeability and things, and it swells, right? And so, yeah, in some cases, the surgeons have to release that tension, but it's not I guess I don't ever think of it as you lost the battle or part of the war for that matter if you have to do with a fasciotomy. It's sometimes the sequelae of the procedure and what you're trying to do to save that person's extremity.
It's just a matter of catching it sooner rather than later, right? You got to get to it soonest.
Exactly.
And Pamela, go ahead.
No, I was just going to say, I mean, the story that you're describing from last night is very troubling on a number of levels, but hopefully there's a good outcome there.
Yeah, we're hoping. Yes, Pamela.
Have protocol, and they do it with every patient, and every patient's not the same. So to get them to break loose from that protocol and to look for another fix, something else, like you said, something's wrong, and they need to start listening to the patients more, because after relocating from Colorado to Florida, it's like doctors down here don't want to do what doctors there done. And it's concerning me, because I feel like every state should have the same health care, but it doesn't.
No.
And
And coming up next, right here on the Heart of Innovation, we're going to hear a little bit more of Pamela's story. Also get to Francine and several others that are here, Carrie and Teresa and Jamie and so many more. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. So it'd be great, Dr. Phillips, to take us back. I can give you a cliff notes, and Pamela, correct me if I'm wrong, but in Pamela's case, so Pamela found us when she was in Colorado. She was on deck for amputation, right? They told you to go home and just walk. And when you can't walk anymore, I mean, I think this was a quote, when you can't walk anymore, we'll amputate, is what the university told you. And she found us, we got her to actually your friend, Dr. Aaron Armstrong. And Dr. Armstrong calls me. He's like, what were they thinking? He's like, you definitely sent me a tough case, but it's not impossible. And he was able to help her. But for some reason, and I can't remember the reason, he said that you shouldn't be living here in the cold. You need warmer temperatures. And we helped you move to Florida, and he helped you move. And then we sent her to another one of our friends there that I will not name. And he couldn't do Dr. Phillips, what Dr. Armstrong could do or would do. And so now, thank God, her insurance.
Blockage that I had. So he did do that much, but we'll just stop there.
Yeah, but now she has to go back to Dr. Armstrong and fly back to Dr. Armstrong to get the additional advanced care. Although you could just drive up to Ohio to go to Columbus and see Dr. Phillips.
I mean, because Ohio and Florida are just right next to each other.
30 seconds.
Someone else did that. Someone else from Florida did that.
Yes, they did. We're always happy to help. We're always happy to help.
Everyone loves Dr. Phillips.
Dr.
I'm not kidding.
76 procedures, so I'm a little different than most.
She really is. I'm not kidding.
The insured past performance does not guarantee future results. Not on offer.
But if John, if you want to take us back kind of to a little bit at the beginning of her story, or walk us through her story and then we'll get to another.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Thanks for joining us today, everybody. It's a Save My Piggies on steroids, or I'm not sure what. We've got a lot of folks that we need to get to. So I think let's just finish up Pamela's story. And during the break, we were kind of chatting. I mean, Pamela, you've had quite a few procedures, and we're on deck for possible amputation. Yeah. We're able to be treated in Colorado. They helped save the leg, it sounds like, and ultimately recommended you relocate to Florida. How long have you been in Florida? And I know that you might need a couple extra procedures still, and you have some of them there and some of them back in Colorado, huh? A lot of frequent flyer miles.
Yeah. I've been here since October, and I actually moved here because we thought the elevation may have been contributing to the clotting factor. So moving to sea level, it has helped as far as frequency. I went from having surgery every week or two to it's been once the past 4 or 5 months. So I'm doing better.
Good.
Oh, that's such a relief. And
so you have all your piggies or no?
You do. She does, and she's walking, right?
I'm walking as much as I can. It hurts so bad to walk though. But I've had like a lot of surgeries to my right leg, and I just had injections done to try to help ease the pain of walking. So I'm doing everything like pain doctors and stuff are encouraging me to do to try to get those steps in. But it's hard. It is.
Well, we appreciate the fight, right?
Exactly.
Yeah, I was going to say exactly that. I appreciate the courage that you had. That must have been a struggle for you when the one doctor in Colorado said, there's nothing more we can do. Why delay the inevitable? Go home and walk. When the pain gets too bad, we'll just amputate. I mean, that's a quote. That's what he said.
That's exactly what he said. And I couldn't take that. I couldn't take that answer. It was like, I cannot lose my leg. And I was willing to do whatever it took to save my leg.
You know, we didn't have a chance to get to a quote, but this is something that I found from Martin Luther King before we get to our next guest. And I think this kind of summarizes some of the perseverance in the fight that you all have. But Martin Luther King is quoted as saying, "Our lives begin to end the day we become silent about things that matter." So, you know, it's incumbent upon us to fight for things that are important. And That's why, Kym, you do what you do, and a lot of us do what we do. And now I did want to get to Carrie in the chat because she also commented that she had compartment syndrome and
Yeah.
had fasciotomy as well. Carrie, are you able to share a little bit with us on that? You're muted. There you go.
Um, yeah, I've never known anybody else that has had this, and then it came up like twice in this few minutes. But mine started back in COVID. Long story, but I'm a cyclist, and I was having trouble with my leg, and they were sending me to all kinds of sports medicine, and then everything shut down with COVID. And basically, so I was just kind of sitting on the couch for about 3 months until finally they could get me to a vascular doctor. And he recognized right away, he's like, we need to get you in for treatment immediately. As soon as I can get my operating room open, you're my first patient. So I waited a couple more days, and he even said, if you have an emergency in the meantime, this is really serious. If you have an emergency in the meantime, make sure that the ER has here's my card, and make sure they call me. So so I went in, for what was thought to be an outpatient surgery. And then he got in there and he said, oh, this was way larger than he was expecting. So he said, you're going to need to stay in the hospital overnight, and I need a longer session with you completely anesthetized tomorrow. That night, so whatever happened in that first little procedure triggered the compartment syndrome. And so I had the same story as your person yesterday. It was just getting worse and worse, and they were escalating. They're calling it, the attending physician is coming in, they're going up. And finally they said, we need to call in Dr. Crespasotto, who's my doctor. So at 2 a.m. he came in, and he was just taken aback, and he's like, he knew right away what it was. He said, you've got compartment syndrome, and we need to take you to the main hospital in Charlotte, and we're getting you in an ambulance. And right now, God. I mean, so I was thankful, for my experience. But he did tell me, like, right now we're at the situation where I'm going to try to save the leg with a fasciotomy, but I can't promise you that I will be able to. So he told me, and I mean, when I woke up from that anesthesia, the first thing I did was, rip off the covers to see if I still had my leg, and I did. So that was the beginning of my whole experience.
So was yours traditional PAD, or Dr. Phillips, there were 2 patients that have come to us in the past year that were cyclists that had a type of disorder that mimics PAD, but it's caused by cycling where there's scar tissue in the iliac arteries. You're nodding. Is that what it was? No.
That's not what it was. But That's what I was thinking it was, because I had in my research come upon that. And I do know another cyclist that it happened to, and they were able to do a bypass for him. But mine's femoral artery all the way down the popliteal. I'm regular old pad.
And what were your risk factors?
0.
Well, no family history of heart disease, no clotting disorders.
Nope.
You had a hematologist.
No diabetes, no drinking, no smoking, no. This is why I even came upon PAD when I was sitting at home doing nothing, and my primary doctor told me, no way, you have 0 risk factors, it can't be that. But finally we ran out of other stuff, so he said, I'm just going to send you to the vascular people because I'm out of ideas. And then right away, when I went for that first ultrasound and AB test, and I was crying because I just was at my wit's end. And the tech who did the scan and the test said, she was a triathlete, and she said, I'm not supposed to say anything because it's not allowed. But she said, I just want you to know you're in the right place, and they are going to they're going to diagnose you. So, I mean, that was just all I needed to hear to, to know that I was going to get some help finally.
And now you,
So,
I hear, have done 4 marathons since.
No, that's not me. But I still cycle. But
Is
somebody
that
else
someone
is,
else who?
that
Yeah,
is
we have someone
Francine.
else.
Yeah,
Francine. Oh
so
my
I
gosh,
really wanted
we
to
got
hear from
another
Francine's
one.
story.
Yeah, another one with no dust gathering beneath her. But you are out and about. Tell us what life is like for you now.
Well,
maybe that's a good cliffhanger to
Oh,
break away,
excellent.
and in the next segment we can finish up.
Yes.
Carrie, how does that sound? Stay with us,
good.
everybody. We'll be right back.
When I was asking the question, I saw the thing and I was like, oh, but thankfully John Phillips is, Dr. JP is paying attention.
Actually, I'm just looking at Joshua. I can see sweat forming on his brow, probably.
I know, right? But oh my God, Carrie, yeah, I got you mixed up with Francine for a second because you're doing well right now, though.
Well, I am and I'm not. So I keep getting, I'm still active and I'm able to cycle, but I keep slowly, occluding or whatever. So this past week I went in and had another stent put in. So this is my fourth surgery. So I'm still don't.
At some point too. Yeah, that's a problem with this disease, and we've talked about it before. But as soon as you have one procedure, I always tell patients you're having another one. So delay it as long as you can. Obviously, yours, Carrie, needed to be done, but at some point.
Go ahead. Sorry.
No, I was just going to say at some point I have a conversation with my patient, like, hey, maybe we should let kind of nature take its course in the sense of if the vessel closes, then typically people have had enough time to develop those collaterals, the bypass we talk about, and then you can kind of let it go. Because Carrie, you don't look very old, and I'm not going to ask you how old you are, but
I'm 65.
Yeah, and so when was your first procedure?
2020. So
yeah, so I mean,
6 years ago.
You're going to be fighting this the rest of your life, and at some point, you just kind of have to let the body adapt to what's happened, and hopefully, because usually if you've saved, I mean, if you haven't lost any piggies thus far, it'd be pretty unlikely, unless if something catastrophic happened, that you would potentially be at risk for it. So then it just becomes a lifestyle. If it's lifestyle limiting or vocational limiting, then yeah, we intervene. But
I go in quarterly.
Sure.
Well, I because there have been so many patients that have come through our doors that say that they have no risk factors, and then we get them a hematologist and a cardiologist. They do a full AFib, valvular issues. They check all of that. They check for murmurs. They check for aortic aneurysms. They send to the hematologist, check for factor 5, factor 11, factor 8, protein S, MTHFR mutation. And still you've had all that and nothing?
Yeah, they sent me to Levine Cancer Institute here in Charlotte, and they ran all the genetic testing and all the factor. I don't know them all like you do off the top of them, but they tested everything. So I go in quarterly for these, scans, and they watch my numbers.
Okay, hold on one sec. Can you have her, go and finish up the story, and then we'll get to.
Welcome back to The Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Well, what a cliffhanger before the last segment ended. Carrie was kind of finishing up her story. So Carrie, in the next minute or two, summarize, where you're at now. And we talked about during break, this is kind of an ongoing process, but you have pretty good spirits and you're a fighter, right?
Yeah, I am, and I get checked every quarter, and so they watch they watch the numbers, and as my the blood speeds increase, and and then I had an MRI, and then that's what led to the last stent. He just said, I keep seeing this getting tighter and tighter and tighter, so that's why I keep going back, and I know it's going to be a lifelong thing, and I just don't know where it's going to end up.
But you're not letting the dust settle underneath you. You are fighting.
No.
You're out there growing those collateral vessels, aren't you?
I've got lots of collaterals for sure from cycling, so that I know I have. So I don't have pain, which is the great thing.
So I love it, and it's a great lesson for people that even if you don't have the risk factors, if you have the symptoms, fight, right? Get checked. Thank you so much for sharing your story. And Francine, I think she's the marathon runner. Francine, you're the marathon runner, right? I'm wondering if she's still on or if she dropped off. No, I see her. Francine, join us.
There, how's that?
You
Unmuted.
are. Hello, Francine.
Hi. Hi.
You were thinking when I was asking Carrie if she was running marathon, she's like, wait, no, that's me.
Right.
We'll start with the best for last. You're already out there. You've run 4 marathons.
I think maybe 5. I might have lost count.
Maybe.
But I was diagnosed at 48, and
Young.
at that time I was a fitness instructor, but I had smoked when I was younger, and I have my father had a lot of artery disease, but I had to have a fempop bypass in 2010. I had it October of 2010, and by April I was jogging, and I continued to jog until I was able to run half marathons. I did do the Dean Ornish program. That was
Yeah. So tell us
recommended.
about that. People who may not know about the heart disease reversal diet, the Dean Ornish, and there's also another gentleman, Estelin, that have a similar
Right.
diet plan that has helped quite a few people.
Right. Yeah, I got a note from my insurance company saying that the Dean Ornish program was available at the hospital really close to me, and that my insurance would cover it. So I did it. And it was a year-long program, and it taught us to eat a vegan diet, like a the Dean Ornish reversal diet, um, a lot of stress management, yoga, meditation, exercise. So I just stayed with it, and I figured I'll do my part as far as my health, and the doctors can do their part. So I try to stay as super healthy as I can.
Francine, can I ask you, you had the bypass in 2010. Have you had any further revisions or any other repeat procedures since then?
The left leg was the fempop bypass. The right leg, when I saw the angiogram, it looked like links of sausage. This is what it looked like to me. Block, 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 block. So I have 2 stents and at least 5 balloons in my right leg. And now my recent tests show that my bypass is nice and clear. But the blockages are now coming above the bifurcation.
Sure. But so I think that's important. So if I'm hearing you correctly, and I think we need to make this point, a bypass, right, which you had now 15 years ago, 16
Yes.
years ago.
Many years.
It's still open
Yes.
if a bypass is done correctly with adequate conduit or vein, they last a lot longer, in my opinion, than our balloons and stents do. And so, and you are a testament to that. So you have great surgeon, obviously, whoever did that, and good veins. And kudos to you for continuing to follow that program, because you do have to keep exercising and maintaining that mobility, because that's really important.
And the only ones, Dr. John, that we see that are going down when there's a fempop bypass or a femtib bypass that have gone down, and we've had so many go down, there are two reasons why we've seen them go down, and it's consistent. Either one, there was no inflow, meaning the doctor never bothered to check the aorta and the iliac arteries and the common femoral to see if there was actual adequate blood flow going down above it to fill the bypass. Or number two, and this one is actually happening most frequently, is there's no outflow. So they find a landing zone, right, where they reattach the bypass below the knee or into the knee, and then the plumbing below isn't sufficient enough to support the faucet being turned on. And what several vascular surgeons have been telling me lately is, Kym, tell your patients to make sure that someone goes in with a balloon and a wire and just make sure that there's beautiful outflow, because if there's beautiful outflow and beautiful inflow, and that surgery is done right, it can last 10 to 15 years and even more than that, which is what you're experiencing, right, Francine?
It's going on 16 years, and my last test showed it was really good. I'm still open. I'm going to try to run another. I'm going to try to run another half.
Good for you. No, again, I think it goes. Sometimes we don't say this enough, but like if you do the right procedure on the right patient, it works.
Yep.
And it's a little scary that we're having to tell patients, if true, that you got to tell your doctor to make sure that their plumbing is okay above and below where they want to fix it. But yeah, I mean, I don't know that it's troubling that a patient should have to tell the physician potentially how to consider a procedure or not. But nonetheless, I guess all things are possible.
Yeah, well, different doctors, different tools, different techniques, different training. And Carrie is saying her surgeon has said that she may need a bypass, FemPop bypass, and eventually. But the interesting thing is there is a new minimally invasive bypass called PTAB, and it provides yet another option. So prior to any surgical bypass procedure, what we're telling patients now is just to double check to see if a minimally invasive option is available. And I know, Dr. Phillips, you've done a few of those yourself, actually.
Again, I think you take the right patient with the right procedure if needed, and then you execute on that. And so everybody gets personalized, or should be getting some personalized health care. But yeah, no, there's a lot of options out there for us, which is good.
Yeah. So we always say just get a second opinion before any procedure, but always the most durable option is what you can do is becoming the best partner in your care, right, Francine? I mean, you ate right, you did your diet, you're the poster child of compliance. And I would imagine your doctor is applauding you for what you have done, and probably attributes the success of the bypass and the durability of it to the steps that you took personally to change your life.
I told him I'll do my part as best I can, and you do your part.
And Carrie is wondering, do you still do the Dean Ornish diet, or have you deviated?
Yes. I stick to it as best I can. One of the things they taught us in the program was if you put in 100%, you'll get 100%. If you put in 5%, you'll get 5%. So I do the best I can when I can. Walking for sure, and I do a lot of yoga and stress management.
Oh, good. People underestimate the damage that stress can actually cause to the arteries with inflammation due to high blood pressure, right? Induced by the stress. But I do want to let people know that while the Dean Ornish program may have worked for her, it might not work for everyone. Make sure you understand the presentation of your disease and get a referral to a dietitian so they can determine the right diet for you. I know for my dad, we tried it and it was not right because he had the MTHFR mutation and he couldn't handle all of the grains. And so for every person, it's different, but the best diet is the one that you are going to stick with. And with that being said, coming up next right here on The Heart of Innovation, we have more stories to come, so stay with us.
There you go.
Woo, you guys are amazing. And once we've introduced you, if you do have a question, we've already introduced you, jump on in.
Yeah, who's
Carrie,
next?
you're asking great questions.
Indeed.
I just want to say something to everybody about what a fasciotomy looks like.
I think I.
Whoops. Wait, Pamela, where are you?
Right
Say something.
here.
Say something.
Could you say?
You have to keep talking or else someone else is going to end up removing you from the main frame.
I just wanted to show you what my fasciotomy looks like on my leg.
Yeah.
Mm-hmm.
So it was a pretty rough time.
But you got through it. You're still on your feet. You're still walking.
I am.
It's amazing.
Kym, who do we need to get to next here?
Who has not, did we get to Teresa? Where's Teresa?
Where's Teresa?
Teresa. Oops, you have to unmute.
Hiya.
Hello.
Hi. I'm your UK person. To be honest, of course I'll talk and talk, but everyone seems to have these like awful like horror stories, and mine's pretty straightforward, to be honest.
30
But we
seconds.
We're
need
okay with that.
straightforward. We
need
like
straightforward.
that. I think everyone's going to be refreshed with a little straightforwardness, and they might even have some questions for you.
Okay. Yeah, I'm not, like I said, I'm more than happy to talk.
I'm from the UK as well. I'm from Manchester, just FYI.
Oh,
hi.
yeah, I'm from Somerset.
A June deadline to reach a peace deal, according to President
Dr.
Zelensky. He
JP,
said the U.S.
Mike
plans
got
to
great
pressure both sides to
on
meet
his
this
last
timeline.
ABI.
This
AM
I knew he
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back to the marathon Save My Piggies on steroids, and now it's an international Save My Piggies. So let's welcome Teresa from the UK. Teresa, thanks for joining us. Share your story with us if you don't mind, please.
Hi, everyone. Obviously, I've been a member of the group for quite a while, and I read other people's stories, and everyone seems to have just gone through the worst time ever. Whereas my story is pretty straightforward. My dad had peripheral artery disease, probably my granddad as well, looking back, but I don't think there was the diagnosis around in those days. I mean, I'm sort of 56 myself now. When I was, I suppose mid-40s, really, I noticed I was having problems with my walking. I like to travel, and I was in Vietnam at the time, and I was just really, really struggling with my mobility, and put it down to the heat and everything at the time. Thought it's just the heat, that's all it is. And it just became progressively worse. And so, like I said, I'm in the UK. And so we're very lucky again, we've got the NHS here, which I know you guys don't have. You need your health insurance and everything. Went to see my GP on numerous occasions, who just kept saying, you can't have that. You can't. You're too young. You're too young. And said it was a problem with my back. Gave me various kind of tablets, sent me to physiotherapists, sent me for an MRI, and I just kept going back and saying, it's peripheral artery disease. Did a Doppler, did a couple of Dopplers actually, which were apparently all fine. And I ended up kind of causing quite a scene about it, really, and saying, I need you to send me to see a vascular consultant. I was in that room not even 30 seconds, and he just felt my pulse with his finger. And he said, yep, you've got peripheral artery disease. And at the time, it was a relief that, I was starting to feel like a hypochondriac, really. There's nothing wrong with my walking. It's my back, it's my muscles, it's this, it's that, and all the other things that they came up with. So yeah, it was a relief. Sent me for a duplex scan. I had I still have, I think, 100% blockage in my right leg and 80% in my left. Had angioplasty, which went well, lasted for a little bit. Before, because the right leg was always worse, that was the one I was always more aware of. And then when the right leg was unblocked, suddenly I noticed how bad the left one was, because it had time to kind of kick in, excuse the pun. Then I went back. Then I went back to see my consultant. because I was having problems again. They did another duplex scan, and it had reblocked. So I had another angioplasty, and unfortunately the artery was split. So I ended up with a 30 centimeter stent in my femoral artery. And basically, I'm incredibly lucky with my vascular consultant. I've got an open appointment. I can email him anytime I want. He always gets back to me. The advice he's given me is just to kind of carry on, keep moving, keep walking. He has said I'd probably be looking at a bypass in the future, but he feels I'm too young to have that. So just to keep going on. And I'm incredibly lucky that I've got really, really great collaterals to the point where is it an interventional, I can't say it. You know, the person that goes in and cleans out all your arteries.
Interventionalist,
Thank
right?
you.
Endovascular specialist, yes.
Thank you.
Plumber. It's just a plumber. Yeah.
Yeah.
It's a plumber. There you go.
Said that there was an issue trying to do what they needed to do because I had so many collaterals and the collaterals were so great. So I'm really fortunate in that, but I've always been quite active. I'm a teacher. I run around a lot. I do a lot. And so I think it's my collaterals actually that are saving my legs more than anything else. And that's kind of my story.
Going. That's far from straightforward, I think. I think there's a lot going on, and it's amazing how you advocated for yourself and just kept pushing it and pushing it. I don't understand how the ultrasounds didn't pick it up unless they didn't have them placed correctly. Usually we see a false normal on an ABI, but usually the ultrasound, in my experience, I don't know about you, Dr. John, I'm not a doctor or anything, but RVTs tell me that the ultrasound is usually pretty on it.
It wasn't with me. They did a few Dopplers, and my consultant is of the opinion that they were listening to kind of arteries and not listening to veins and not arteries.
They were doing veins. That's interesting. But it's even more interesting that all the vascular surgeon did was touch your feet and feel those pulses, and he knew right away.
Yeah.
And that's why we always say, take off your socks at every appointment and say, Doc, touch my feet.
Yes. Yeah. I think for me, the hardest thing about it all was, I said, it's a family thing. And my dad, different times, my dad retired at 50 from a job that he really loved, and he just kind of sunk downhill. And so once I'd had the diagnosis, once I'd had the first angioplasty, I think I started to take it quite hard then. I think mentally it's a very, very difficult disease to learn to deal with, because it is, I mean, it is a life sentence because it doesn't go, does it? But by the same token, I think it took me a while to get my head around the fact that I was still Teresa. I wasn't Teresa with PAD. I couldn't allow it to kind of take over my life and stop me doing the things that I enjoyed. So I had to learn to make allowances for it. So yes, I still travel, but I plan where I'm going to go. I plan things like public transport. I plan, if I'm going to the theatre, how far away the car park is, that kind of thing. So I'm very aware of it, and I won't let it take over my life anymore.
I love that you say that I'm not going to let the disease define me. And I think that's such an important message for everyone to hear, that you might not be able to do the same things you used to, but what can you do? How do you adapt? How do you still figure out the things that you love to do and how to get them done?
Yeah, absolutely. And I did go through a really low time, and that's when I joined your group. And, I was that person asking loads of questions and all the rest of it. And now I just feel, kind of 5-6 years down the line, now I feel that I'm so much more knowledgeable about it all, that I can help other people who were in my situation that I was in 5-6 years ago, that are in that situation now. Because it is a limiting thing, but I think it's limiting if you allow it to be limiting. Does that make any sense?
Yeah. It completely does, and I am so thankful that you know, you're sharing your story, and it goes to show that there's so much, again, that you can do to become the best partner in your care, and it's not easy, right, to walk through the pain, but you know that every time you feel that cramp and you're walking, you know your body is adapting, it's
Yeah.
growing natural bypasses around those blockages.
I remember initially everyone saying, you've got to walk, you've got to do this, you've got to do that. And thinking, well, how can I? It hurts too much. Why am I going to do something that's going to hurt? But actually, that's what you've got to do. And that's
Thank you
quite
so
hard to
much.
get your head round.
I appreciate it, Teresa. And coming up next, right here on the Heart of Innovation on KDOW, we'll have final thoughts from all of our amazingly courageous PAD warriors. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
Attention.
And I think
Did
that
we
we
get to
still have a
everybody?
couple.
I was going to say.
No, I think we still have Lori just joined us, and I think Jamie might want to say something. And I know Douglas is just chomping at the bit to ask a dozen questions here, which are great questions. So if Dr. John, you could take an extra 15 minutes after to,
Sure.
and we'll continue into kind of like a little bit of the after show. That would be great. So if people
I'm
want to stick
happy.
around.
I'm happy to listen and answer questions. I'm not going to speak.
30 seconds.
Final segment is 4 minutes. Dr. John, do you want to guide this last 4 minutes and call on a few final thoughts?
I have a question. I just
Hold on,
went.
Lori.
Okay.
Hi, Lori. Hold on.
Okay.
Hold on.
6159 800-279 6159. That's 800-279-6159.
1220 KDOW. Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
You know, it's really hard to do a Save My Piggies with one guest and the time allotted, let alone six, but we're getting after it here. And so stick around for the after show because we're going to continue the conversation. But with the 4 minutes we have left, Jamie, you've been patiently waiting to share your story with us. So welcome to the show. Just need you on mute there. There you go.
Good morning. Good morning. I'm in California, USA.
All right.
Me too.
Thank you. My name is Jamie Hale. I am very new to this PAD. I have done a lot of research, and I came across the group with Kym, and feel, wow, there was so much more I needed to learn. And I appreciate your time and having me on your show today as a new patient of PAD. I feel that there was a lot of signs and symptoms for myself. What ended up having was, I had heard you say earlier, yes, I had a mild heart attack and I had a stroke. And I weigh 110 pounds. I'm 5'2". I thought I was very, very healthy. I exercise. I have 4 children, 4 grandchildren. I live a very active life. I sailed. And over the 2 years, I did not feel good. I sold my yacht. I work in the mortgage industry. I have for 40 years. It's a very stressful industry. And I just thought, okay, maybe I'm getting tired, right? And I kept going to the doctor, and survivor of melanoma. So they, couldn't figure things out. And in the meantime, I ended up with kidney stones, which was odd to me. It was the 4th kidney stone surgery. And them doing the CAT scan, they located aortic calcification into other branches. And nobody really did too much because there was a lesion on my spine that they focused on. So I went through the 4th kidney stone surgery and was sent in for a PET scan. The PET scan also came back with the aorta calcifications and that there was no known aneurysm. And this was all prior to my heart attack. And so I just kept going and going to work. And, I worked 10 hours sometimes a day. And, no big deal. And I'll work on a Saturday, that's what I do. And I noticed I wasn't able to work overtime, and I was coming home exhausted even more so, and sinus infection and everything. It just felt horrible. I felt horrible. So, I went to the doctors in February at the hospital and felt I was having a heart attack. And it was just a chest crushing, and it had gone into my neck. And they came back and said there was nothing on the EKG and there was nothing in my blood. And they had done another, they said, let's do a nuclear. And I got myself a cardiologist and did a nuclear medicine stress test, and came back normal. Saw that cardiologist 3 times. So when these things would happen, I just, the hospital said it must be a panic attack. So I decided, okay, it's interesting. I'm not doing too much. I'm not too stressed out, but all right. Well, what I didn't know was in 2013, I had had my left hip replaced. They wanted to do a dual replacement at that time, and I declined the right hip. I didn't think I would be able to. Being a degenerative disc disease person from the time I was 15, I just felt that would be too much for me. And at that time is when, if I would have known about vascular issues, is when I feel I should have seen a vascular specialist.
And that is a really great lesson for others to learn and to end on. Leg health can indicate your risk for heart attack, stroke, and even amputation. So get checked. Call our hotline at 1-833-PAD-LEGS.
I agree. Absolutely. And
you've been listening to.
And so I want to start the after show. I want to continue this. Jamie, I want to continue your story here. So you ended up, you wish that you would have learned more and followed up with a vascular surgeon about your vascular disease. And if you have calcification in your aorta, it's likely in the heart. And we always tell people, if you have it in the legs, it's likely systemic. Get your heart checked.
Yes. And I will agree with you on all of those aspects, and how naive I was in 2013. I'm 58 years old, so I was younger, to not realize that I was a smoker, and had only stopped smoking during my pregnancies. I'd started smoking at 13 years old. I always had it in my crazy mind that I needed to make sure that I didn't have cancer, my lungs. It was always, that C word. It was never vascular. It never dawned on me the harm I was doing to my vascular system every time I smoked a cigarette. And I want to stress that. And I do feel that that was a huge part of even my hip replacement surgery. So I'm not here to put anybody down for that addiction. We all have an addiction, no matter what it is. I do believe in that. But for me, it was cigarettes. And it went hand in hand with my career. It went hand in hand with me. It used to go with me on the airplane, in the elevator, in the office. I come from that period of time. And I just, became more of a quiet smoker. So people really didn't know. And that was one of the things I look back on now, where if I could have changed some things, I should have done that. And I should have done more research on what was causing me to have my hip replaced and to have the right hip replaced. But I wanted to believe it was degenerative bone and disc disease. So going forward now, always having issues, like you said, with my chest and being told it's angina, and or panic attacks, and going that round for years. And then, of course, going to the hospital in February and doing a nuclear medicine test, and everybody telling me everything's normal. So I wasn't walking and doing exercise like I normally had been doing my whole life when everything went, into COVID mode. And I really changed a lot of that. I think we all did in working remote. We didn't, I worked more overtime. I worked at home. I, did my no walking and no exercising like I had normally been very, very active, and riding my bike and on the beach and sailing and that kind of thing. And so I, didn't go to the hospital that morning at 3 o'clock in the morning when I got woken up with what felt like a boa constrictor this time, and I had these little feelings, but I would just take off my bra. It would go away. I would get up, I would walk, it would go away. This particular morning, I didn't have a bra on to take off. And I sat up and I thought to myself, now I'm already sleeping with a bottle of aspirin next to my bed. And I got a bottle of aspirin in my car, and I have a bottle of aspirin in my purse at all times, and I have one in the office on my desk. So I have 4 bottles of aspirin at all times now in case something. And I've done research where for women you can cough to try to help yourself if that's truly happening as a heart attack. So when I got woken up, I was very lethargic. Now that I look back, there were many, many signs and symptoms. But the weird thing is that I was only getting cramps like Charlie horses in the back of my left leg and my right leg. I wasn't getting them a lot. I wasn't getting, these signs of swelling and where my hip was connected to in the thigh, I was having a ring of pain there. But because that surgery was so, to me, I went back to go do the right leg and I fainted right in the lobby. I can't, I can't do certain things. I'm not good at that, right? So I went ahead and thought, okay, I'm going to have to see my hip doctor because it's hurting more up there. It's hurting more up there. I need to make an appointment. So I finally made an appointment. Well, I didn't get to that appointment. At that morning at 3 a.m. when I got woken up with that pain, I told myself, it's okay. Do I need an aspirin? I said no. I did some deep breathing and meditation sitting there, and I went back to bed. And at 5 o'clock in the morning is when it woke me up, and it went all the way into my jaw. And that is when I could barely get up to get the aspirin into my mouth to chew it. And I'm still thinking it's a panic attack. So I didn't go to the hospital. So by 6:10, I looked at my watch and I said, oh, I'm feeling better. I might as well get in the shower and get to the office. I'll be there on time. So I got in the shower, went to the office, but I kept wiping my right side of my face and I felt like drooling. People at the office were looking at me a little funny. I kept staring at my computer like what was the next move I needed to make. And nothing was really clicking with me yet. Well, I went for a week, and the next Sunday night, I went to bed and I thought everything was normal. And Monday morning, I woke up, I couldn't move my right hand. It was purple, it was red. It felt like I had broken my wrist. So I decided I'll go to the office and see if I can sign on. Still wasn't thinking, And at that point in time, I couldn't move it to sign on. And I said to my team, I'm going to go to the urgent care. I'll be back. So I left to go to the urgent care and thought I'd pop into the cardiologist office really fast. They told me everything was normal. And they said they couldn't find my records. So I was a little irritated, and I had been on the Medi-Cal system for a long time and had taken myself back to work for about 8 years. So I had a PPO insurance. And I said, this is ridiculous. You have a PPO insurance. You're going to go to a different urgent care right now. And my girlfriend told me to go to her urgent care doctor, who owned the urgent care, but decided to do urgent care because she could take care of patients better. So I went to her that morning. Within an hour, she had looked at me and said, I'm going to tell you right now, you either have lupus or rheumatoid arthritis. I feel that you have PAD in your legs. I'm going to run a quick ultrasound. I have an ultrasound specialist coming in. I need to do some infusions to get control of the inflammation. I need you to take this serious and get a cardiologist, an endocrinologist. You need a rheumatologist. You're also going to need an osteoporosis osteoporosis doctor, and possibly MS. I'm going to highly suggest a neurologist as well.
Wow, she really threw everything
At the
at you
book.
all at once. So did you end up ultimately, though, I want to clear this up. Did you ultimately end up with a heart attack at all?
Yeah, I did. I had a mild heart attack a
Okay,
week
so that's
before
what
I had
turns out.
met her. And I had
Okay,
had,
so they did
yeah,
show. Okay.
yeah, and
So
yeah.
then you ended up, once you got your legs checked, have you had a procedure on your legs
Oh, yes.
at this point?
So at
Okay.
this point, I took off 3 days from work and didn't know how serious things were still, and got myself a cardiologist that's also an endocrinologist that's also vascular, Dr. Kazai in Thousand Oaks. I got myself
Who he is, yeah.
in with yes, I feel so blessed. He took me the next morning. Then I got myself Dr. Cohen as a rheumatologist. He's also my osteoporosis doctor, MS doctor, and he's also vascular. And at that point in time, I also have my neurologist. So between the team that I was able to get and turned her into my new GP, the test came back positive for rheumatoid arthritis, which my doctor prior had told me no, no, no for years. Every time they did something for the osteo, which my hip surgeon had already said I had, he said, no, it's minor arthritis. Well, my bone density is a -7 to -14 on certain parts of my spine. The lesion is there. I'm starting a new medication for the osteoporosis, which is terabartadine.
Yeah, I want to stick with, you have a lot going on. I want to stick with,
So what I've
just the vascular at this point.
Yeah,
We
and
still have a couple more
yeah,
stories as well we want to get to.
I'm doing medications to get the inflammations down. And
Yeah.
I went into with Dr. Kazai, he took me into UCLA for the CT angiogram. And that was a great cardiologist team. And then now I've had the angioplasties, which he does at his inpatient facility in Thousand Oaks. And
Offices, yeah.
3. And the last one was my left leg, which was done twice. And they were able to get through a 99% blockage finally and balloon. My upper thigh on the left, I'm going in for that because even though he went through, it blocked again, small by my groin. So they're going to go in and they're going to balloon that. So I'm trying to save my left leg. I did get an allergic reaction to the tape on the second procedure on that leg. And that seems to be healing. He's been monitoring it. I see him again on Tuesday. My right leg was 60% blocked. He went ahead and he was able to get that one unblocked, no stent needed or balloon. And there is the back part that's got a little blockage, and he's going in for that one on the ending of this month. So I feel very blessed. It's something, I'm watching my left leg. I have since, when I met with him and he said he'd take me on, I made an agreement with him I would quit smoking. And I
Good
told
for
him,
you.
thank you. And I told him I would dedicate everything 100% to healing and getting myself better. And I went and did hypnosis. And so from the first session, I haven't smoked in 3 months.
Good for
And
you.
yeah, and she said that, there's a lot of good things in with that, but I feel great with that aspect. And I am a non-smoker, and it went down in my charts at 58 as I'm a non-smoker now.
I
So,
love that. And I can see Douglas is he's in charge of our smoking cessation program on Monday nights, and he's in the background here cheering you on. And you're always welcome on Monday nights, as well as anyone else who's watching. We do have a smoking cessation group.
Thank you.
Just email info@padhelp.org. Join us and just get support. And then also, even if you quit, share your story with others, help others that need a friend along the way in their journey to quitting.
Yes, thank you. And thank you for having me, because I've learned so much from your group, Dr. Kym. Thank you. And from your live. And I really
I got a doctor, but
Yeah, please keep doing what you're doing, because I think that there's so many people that have, their knees done. Like right now, I'm concerned because I do have my father has the MTHFR mutation,
Yeah.
and my uncle who passed away from an aneurysm in his brain. So I have been tested for that, and I'm waiting for the results. I should have them next week. And I've also been tested for the cardiac amyloidosis,
I don't know what that is.
which is very rare, but it's only rare because it's misdiagnosed. And so, yeah, so we'll see. And so I'm on the proper blood clots. And I do feel I'm with the proper, Dr. Kazai has been amazing. So, and I do feel that if you're going to do an angiogram, that you should most definitely do that procedure at a major university.
No, I will disagree with you there.
Really?
You need to make sure that you choose the doctors wisely, and
Yes.
the title of a facility and the title of a physician does not equal advanced care. And you can get different variances in care at every single facility. Please call our hotline because you can get amazing advanced care at an office-based facility, just as you can at a large tertiary center, such as what Dr. Phillips works in, as well as at a university. But you can also get core care. It just depends on the doctor, and every single patient must actually have a consult with the doctor to determine if that physician, title aside, is the right physician for your presentation of disease, period. Sorry, I needed to jump in.
No, thank you.
Didn't mean to contradict you, but it's the biggest misconception that's out there. Name of a facility, title of a facility, ranking of a facility does not equal advanced limb-saving care. It's the specific doctor that has the appropriate skill set. Sorry, Dr. Phillips.
No,
I'm sure.
I understand. Thank you for
Just listening. Yep.
Thank you.
But I'm glad you found the right care for you. Your doctor does have an office-based facility and does have hospital privileges.
Yes.
And so depending on the situation, depending on the patient, depending on the tools available, I know your doctor is able to make the best decision as to where you're most appropriately treated, but he might not be the right doctor for every single patient. So it's really important for patients to know. And that was one of the things today, Dr. Phillips, that put me in a funk. So I'm a little sensitive on it. Is there was this big uprising in the group where someone had posted that they wanted me to post a list of advanced skilled doctors. And I'm curious from your perspective to have a list like that that's available. You have the Society for Vascular Surgery, you have SCI with its New the Pulse campaign, you have the Society for Interventional Radiology, you have companies like Endologix and LimFlow, and they post their doctors list that use their tools and techniques or who are members of their society, and people go on there and you don't know if you're getting the right doctor for you. Just because there's a name on a list, it doesn't define the best doctor for your particular presentation of disease. There's so much consideration for the right doctor, right, Dr. Phillips?
Yeah, I think vascular intervention as a whole, and this is just, again, me editorializing, so take it for what it's worth. What is Dave Ramsey says, the advice is worth what you're paying for, so this is free. So I will say that because vascular intervention, there's so many people in different subspecialties that kind of play in this sandbox. It makes it sometimes difficult for patients to find the right physician, and it is sometimes fraught with dabblers, so to speak. And I mean, again, when you go to an interventional cardiologist, and there is, and this is again me speaking, but there is kind of an acknowledgement within the community that if somebody needs something done and it gets, for example, they have a heart catheterization at a smaller hospital and they've got some more complex blockages, they typically send that patient on to another facility to get that procedure done, meaning stents. I noticed that doesn't necessarily happen that much in the vascular space. So that's one of our shortcomings. But again, it's also because you can have interventional cardiologists, you can have vascular surgeons, you can have interventional radiologists doing these procedures. Typically, when you go see somebody for lung disease, you're seeing a singular lung specialist or a kidney doctor or an oncologist. But that's part of the problem with our with this subspecialty. So, I always just encourage patients to, yeah, I mean, you can get a list of a physician who does X, Y, and Z, but really just kind of ask that physician, okay, what are you considering doing, and how many of these have you done? I don't, and if a patient asks me, do you use this device, that device, or other device, I honestly don't care. I mean, to me, that is a decision that I need to make with them, but I don't have patients suggesting that I do X, Y, or Z device because that, that's a lane you don't really play in. But I think if the patient asks the physician, okay, do you do a lot of these procedures? And if you can't do it, would you send me to somebody who can do it? I think that's really important. I've said this before. I mean, there are good mechanics, bad mechanics, good plumbers, bad plumbers, and good docs and bad docs. And it's unfortunate that patients have to sort these things out, but you can help people, we can help people, and we're here to help. I'll just say that.
Yeah, it's so true. And that's why I had a conversation like this with one of the companies, because I just think I know that they want to promote their doctor finder to patients. It's the way to marketing to patients about their such, but I just think it adds to the frustration that, on the one hand, it's great because patients know options that are available, but then they go to one of those doctors and they say to you, Dr. Phillips, you're on this list. You do this procedure. I want that procedure. Why can't you do this procedure on me? And that's a little frustrating versus the way when a patient comes to us, we say there are all kinds of these different options that are available. And you can ask the doctor about the options available, and you use it as an opportunity to have a productive conversation to say, hey, you know what? I want a doctor that has all of these options available. Although, you know what, Dr. Phillips, you know as well as I do, with some of our friends in other countries, the miracles they can perform with just a wire and balloon, the things that they can traverse. I mean, it's amazing. We have this Dr. Hayakawa, I can't say it, Hayakawa, who we're going to have on the show very soon from Japan, and he doesn't have all the tools. He literally is known to be a master with a wire and balloon. So you just need to have someone that has, as Dr. Phillips said, like, let's talk about your outcomes. Let's talk about other patients that are like me that you've had successful outcomes with.
Yeah. And that's, I mean, that is that's a difficult, that would probably be a difficult question for me to hear from a patient, because most patients aren't going to ask you that. But it's certainly a welcome question. And I have, and I've heard that from other physicians as well. I don't keep track of how many procedures I've done, but I can give you an estimate of how many I've done in a year and whatnot. And I think that's where we fall short. We sometimes do not check our egos at the door and let pride get in the way of taking good care of the patient. And that's where we could be better as physicians, in my opinion.
Yeah, I think that that's so true. But the authenticity that if I came to you as a patient and I said, hey, how many successes have you had with presentations like mine? Just a candid discussion to say, you know what, honestly, we've had a variance, right, in outcomes. And what I'm going to tell you is I'm going to do my best. I have all of the options available. And we're going to give it a really good try. If we're going to try going through the groin, we're going to come down and tackle that blockage. And you know what? If we can't get through that way, we're going to try coming up from below. And you know what? I always have the option to send you to a vascular surgeon if we need to consider a bypass. But we're going to work with you. And what I need from you is to be the best partner in your care as well. And change your diet, quit smoking, as all of our folks here, and what Jamie was saying, that she quit smoking. She's like, I'm going to be the best partner in care. And we had, who was it that did the Dean Ornish diet? Was that Francine that did the
That was
Dean Ornish
Francine, I think.
diet? And
Yeah.
she's, stuck
Yeah.
with it. You need someone that's going to be the best partner in your care. And if you do need help, figuring out the physician options in your area, definitely give us a call.
Yep.
But we always suggest a second opinion. And someone like Dr. Phillips, we've talked a number of times and worked with a number of patients together. And he's always the first to say, you know what? I don't care if you want to get a second opinion before having a procedure. I get it. He welcomes it.
Mhm.
Never be afraid to get a second opinion. And we always suggest that before any procedure, because we've even had patients who just had to walk, and didn't need a procedure at all. It turns out they just needed to be told how to walk, to quit smoking, and to eat better. And that
Yep.
makes all the difference. We have one more
100%.
person. Thank you, Jamie, for sharing your story. And we just wish you the best and keep us up to date. And Lori, did you want to step in?
I don't really have a whole
Thank
lot
you.
of time, but I'm sure the time's going to come where I want to step in.
Yeah.
I was more worried about, I called the doctor that, you had actually the limb saver in Homa. They told me to go to, but I
Am
didn't
I all right with your
see
phone?
the doctor. I'm sure they did the best that they could for me, but I got to see the doctor's assistant, and I'm just
Oh,
hoping
yeah.
that's just as good as seeing the doctor. Like, because I have blisters on my legs, and it's one of them is really scary. It like almost looks infected. I hope I did this. I hope I did this right. Can y'all still hear
Yeah.
me?
Thank you, Lori. Yes, we worked on getting her.
I
What?
use
One of our mutual contacts over there in Houma, Louisiana. And he was able to get her in right away, seeing the
Oh
need. And
yeah.
right now, and Dr. Phillips, you probably have had situations where someone has reached advanced stages. Excuse me, I'm choked up here. Stages of disease. And it's like, you got to tackle the heart first. I mean, they might have blisters, on the legs, but oh my gosh, there's other things going on with the heart. And I'm sure you've had those situations, always life over limb, but it's
Yep.
really frustrating when both are in jeopardy.
Yep. Nope.
Not
Yeah.
frustrated. I just want to make sure I'm doing the right thing. They have like 8 tests, and
Yeah.
they're really, the testing is unbelievable because they'll have everything in by March 3rd. I just want to make sure that it's the right testing. And I do have issues with my heart. I mean, I've had massive heart attacks, widowmaker, so I'm sure that, maybe just a regular PAD, and I know that's what we're sticking to, but I'm sure that they want to test for other things as well. So that's all. I just was a little worried about the assistant part. Like, I guess the assistant checks with the doctor and makes sure he's doing the right thing. So I'm probably worried for nothing. Probably nothing, I'm sure.
Yeah,
And one
Lori,
of
I'll
the
just
things that, go ahead, Dr. Phillips.
sorry, I'll just say that we have a lot of physician extenders in our practice, and you'll see that throughout the country because there aren't enough physicians. But at least I can say in our group, when one of my APPs or PAs sees a patient, they always run it by us. We work in collaboration with them. So I have to imagine they're talking to the physician and they are coming up with the best treatment plan for you.
Great. Well, thank you for easing my little nerves, easing my nerves a little bit. I kind of figured that, and
Yeah.
trying to do the best of every situation, but it was something worth asking for me,
It is. It is. And it's really good to ask those questions. And you showed me Dr. Phillips, they are giving her the run of tests. I don't think there's a test that they're not giving her right now with her symptoms. So, and they mapped her out. I don't think a day is going to go by without a test. But if you do feel like any symptom, always make sure you don't take any chances. You don't wait. You dial 911 and you get that heart taken care of. I think that's so important. Do not ever take a chance with that as well. And I think Jamie's story attests to the fact don't hesitate.
Right.
Call 911.
Yep.
But I can also check with the doctor as well if you'd like on Monday and just make sure, because one of the things, if you are feeling like anything's escalating, I'm sure you could go to the emergency room. They have privileges at, and you can get in there and get that battery of tests performed literally within 24 hours if you're having symptoms. So just please don't take any chances, okay?
No, I would.
Okay.
But I
Thank you,
thank
Lori.
y'all so much, Kim, and please keep doing what you're doing. And the doctor too. I really appreciate it because I knew nothing before I came along this group. So I'm still new at it. I'm still learning every day. And I just want to say I appreciate it and thank y'all both so much.
You are, we just love that you're advocating for yourself, and thank you, Lori. I want to get to Mike, who's on his mom's phone. And then Douglas, if he wants to jump in with some questions, but Mike, we'll take a few more minutes here so we don't take up Dr. Phillips' entire day.
No, just I wanted to let Dr. Phillips know. You mentioned earlier, Kim, because I've talked to you about my ABI results. I've just had a recent ABI this week. Now I'm back in the UK, and I haven't had one since last January. Well, my podiatrist did one, but I wasn't too sure about that. But I've had one at my doctor's, and I've gone from 0.68 to 0.94 on my left leg, and 1.0 to 1.07 on my right. So I just wanted to let you know that, Dr. Phillips.
Awesome, dude.
Just because of what I've been doing, I'm doing running stents on the treadmill now. And it's all thanks to you guys, you and Kim and the rest of the people on the group, giving me that motivation last year when I did the Save My Piggies myself. And I just want to thank you because I'm really pleased with my results this week. So he even
That's
said
awesome.
that
Congrats.
if he'd have got these
Congrats.
numbers last January, he wouldn't have referred me to the vascular surgeon, who, by the way, wasn't very helpful when I went to go and see them. But I didn't really need to be fair, because I've done it myself.
Yeah.
So.
But it underscores the important. Like, you can have an improved non-invasive test or a quasi-normal one, but still have blockages. May not have a lot of symptoms, but still have that risk, right? And the risk is cardiovascular or cerebrovascular disease. And so it's important to continue to fight for appropriate testing and as well as risk factor reduction. So we talk about it ad nauseum here, but it can't be underscored. Make sure your blood glucose is under good control. You stop smoking, you're exercising, cholesterol is under control, blood pressure, all that stuff.
Yeah. Cholesterol's gone.
Good job, though. Good job, Mike.
I've had another blood test, and my cholesterol's halved from last January.
Yeah.
So everything's back in range with my cholesterol. I know that I've still got the narrowing in my artery, and I know that will stay there. But I'm keeping on top of everything with my diet and my exercise every day. I don't stop exercising every single day. So yeah,
good.
I'm on it 100%. So,
but just so we can make Dr. Phillips blush, tell him what you told me about the impact of that conversation and the fact that he said, you know what, here's my cell phone number, reach out to me anytime. How much that really meant to you and how motivational it was.
Yeah, definitely. Just to know that I had a doctor on the other end of the line that could just answer anything. Well, not answer anything, but to be helpful. Has been amazing just to know that I've got that backup there. So thank you.
Well, thank you, but it goes without saying, and sometimes we as physicians miss out on these interactions a little bit because you see the patient in the office, you see him in the hospital for procedure, and then that's kind of it. But you don't really ever converse with them outside of that, or see them in their quote natural environment at home or whatnot. And this is having these conversations is cathartic for a lot of us because it punctuates the importance of what we're able to do and the impact that we all can make on changing a person's life. And I think that's really important. So thank you, Mike, for sharing.
Yeah, thank you. And it's 1 year on the 13th of February since I had my last cigarette. So it's 1 year coming up. So I'm on it.
It's awesome, dude.
100%.
That is awesome.
And our final thought and question from Heinz, and then I'll just mention there was a YouTuber that I want to mention before we close out here, but Heinz, go ahead.
Hey, Dr. Phillips. Douglas said he's good, but he posed a question earlier in the show about how does altitude affect PAD? I mean, a lot of us, like me, I live at 6,400 feet. You explained that to me 2 or 3 years ago, but maybe it's good as a refresher.
Sure. No, the higher you get, the less atmospheric pressure. So there's less oxygen, so to speak, which is why, when folks are training to climb a mountain or whatever, they have to acclimate. And when you have less oxygen or ability to carry oxygen, that can make things worse in the setting of underlying peripheral arterial disease or coronary artery disease. So I think, that in the cold weather too, to some degree, people, when it's cold, they get clamping down to the arteries that can make some disease processes work. But, in Denver, you're a mile above sea level, I think. So that's probably not a game changer for most, but can be beneficial. I think it was Pamela who mentioned that she had relocated.
Yeah.
Thanks.
Thank you, Heinz, for bringing that up. Appreciate it. But I appreciate everyone, for joining us. I want to mention Gary the Holier, I think it is. He says he's 50 with PAD, and last Easter he was 310 pounds. He couldn't walk 400 feet. Now 148 pounds, walks 2 miles all the time, and he swears that diet and walking play a big part in a long life. And can't argue with that. And great job, Gary. Thank you for sharing. And thank you to everyone who has shared their story today. So many lessons to learn from. I'd love to just give Dr. Phillips the last final thoughts here to sum up the lessons that we've learned along the way and where we go from here.
Yeah, I mean, again, I think it goes back to, that comment from Martin Luther King, when things matter, you can't be silent about it. And so you have to fight for, I wanted to talk about the Beastie Boys, fight for your right to party, but no, well, you can do that too. But you have to fight for your limbs and fight for your piggies, and if you're not getting the answers you think you deserve, or if it's not the right answer, you find somebody who can help you. And Kym, thank you for doing what you do, and obviously, it becomes very apparent to all of us that listen when you interact with a patient who is in pain and maybe not getting the care that they need. You're very passionate, and you are a dog with a bone, and don't quit. And so keep fighting that fight, and we'll do our best to help you out.
Thank you everyone for joining us. And yeah, 1-833 PAD legs. We're happy to help you. We don't give medical advice. There is enough of that out there.
Yep.
We're just here to help guide you in your journey, help you learn how to advocate for yourself. And most importantly, I love that quote that you said earlier. You got to speak up. Can you read that quote again, Dr. Phillips? I think that is a great way to end this, because every one of you, it's because of you, it's because of your voice that you're getting the care that you need. And if you need an additional voice, I'm always here for you at 1-833 PAD legs, and we'll help you every step of the journey and advocate for the right care for you.
Yep. So he said, our lives begin to end the day we become silent about things that matter.
I love it. Thank you so much, Dr. Phillips. We appreciate you so much. Mic drop.
Happy to
Make
help.
sure to like
Mic
the
drop
video,
it.
subscribe to our channel.